policy and practice. Why these paper presentations are happening today is largely because it is all these papers have some or the other connection with the entire theme that the Digital Citizen Summit is trying to focus on. Before we move into the paper presentations, I would just like to give a quick introduction to the academic panel that we hear who is present, who will be reviewing these papers. We have Dr. Akansha Nathani, who is working as an assistant professor in the Human Science Research Center at IIIT Hyderabad, India. She works broadly on data governance, regulations, and data infrastructures in EU and India. She worked as a DC Perit visiting fellow in the Department of Politics and International Studies, University of Cambridge, UK in 2023. We're happy to have you, ma'am. We also have with us joining us Professor Abdul Shaban, who is the chairperson of the Center for Public Policy, Tata Institute of Social Sciences. He has previously served as the chairperson of the International Relations Office and is the deputy director of the IFTIS Durjapur. His area of work relates to regional economic growth, cities, entrepreneurship, and creative industries. We're happy to have you with us here, sir. So we will be first moving on to the, since we do not have the first presenter here, we'll be moving on to the second presenter who is present. So her topic is, may I please request Amreen Faik to come up? Yeah. So how the flow of each presentations will be, we will be doing 12 minutes of the video recording, we'll be playing that, and after that we will move into any questions or comments that the panelists have for our presenters. So the second paper, which is the contributions of health tech and startups to the healthcare sector. That's the one that we'll be starting with.
Good morning, everyone. My name is Amreen Faki. I'm a research consultant at Augusta International Foundation. The title of my presentation is Contributions of Health Tech Startups to the Health Sector. Health sector is observing significant changes in the way healthcare is delivered to people. There's a rise of personalized care where health packages are customized according to the needs of the individual. A great example of such type of care is value-based model, where care teams including doctors, behavioral health specialists, support staff and nurses provide care to people, and they are paid as per the improvements in the health status of the people. Personalized care is one of the forms of innovation. Startups bring different forms of innovation to the domain of health. They contribute in a variety of ways. They enable booking diagnostic tests online. They enable booking appointments with doctors online. They make variables which keep a track of body vitals. They also produce enterprise technologies which reduce the burden of hospitals. In this paper, the author intends to determine whether online care makes healthcare available as and when it is needed, whether online healthcare is reducing waiting time, whether it is reducing trips to family physician, and whether it is bringing changes in the health status of the patients. In addition, the paper intends to compare cost of online and offline care and assesses the service quality of online healthcare provided by startups. The fieldwork is carried out in India. I will briefly describe the theory which is used for this analysis. So, the author focuses on theory of disruptive innovation. So, Clayton Christensen says that disruptive innovation are brought by small disruptive firms called startups. The theory of disruptive innovation states that large-scale companies are replaced by small firms who introduce disruptive technology in the market. So large-scale companies have their internal processes adhere to the wants of their mainstream customers, and they tend to kill ideas which deviate from the mainstream market. So disruptive ideas are killed by the middle-level managers before they reach the top management. For explaining the differential effects of disruptive technologies, Clayton Christensen categorizes innovation into two types: sustaining innovation and disruptive innovation. Sustaining innovation is that which helps a firm move up on the product performance strategy. For example, airplanes that fly farther, computers that process faster, batteries that last longer are all examples of sustaining innovation. But disruptive innovation are small, cheap, simple, convenient to use, and they do not compete with the mainstream products head-on, but find new markets by going underway. To exemplify this theory, Clayton Christensen gives example of the computing industry. So initially there were mainframe computers which were very gigantic and lumpy and which could fill a whole room, and it required years of training to operate them. Mainframe computers were disrupted by mini computers who were smaller in size, they were cheaper, and they reduced the cost of owning computers to about $200,000. The mini computers were in turn disrupted by personal computers who were much smaller in size, and they reduced the cost of owning computers to about $2,000. And personal computers were again disrupted by handheld smartphones and notebook PCs. So, how is this theory of disruptive innovation related to our analysis? Startups are disruptive firms because they bring disruptive business models to the market and they produce disruptive technologies. I have given examples here. So, telemedicine is a disruptive business model. Why? Because it breaks the barrier of geographical limitations. Basically, it takes the services to people who might not be able to visit doctors physically, and it also reduces the burden on in-person visits. Then startups also have invented disruptive applications like hospital information management systems. They reduce the burden on hospitals. Basically, they streamline the admin work, the clerical work that the hospitals do. Then startups have also invented diagnostic tools which are very portable, affordable, small, cheaper. For example, point of care diagnostics, which are used at the place where the care is delivered. And as we spoke about in the first slide regarding value-based care model is a disruptive business model where it's a new way of delivering care to people where doctors and nurses are paid as per the health improvements in the patients. Moving to empirical literature, there's an absolute dearth of literature examining the contributions of health tech startups. Since there is no direct literature on startups, the author relies on literature related to mHealth, mobile health technologies. Considering the first variable, accessibility, so there is limited literature on accessibility of online care. In fact, the author found no robust study assessing the accessibility of online care. Literature review findings on changes in the health status. mHealth has shown to improve health status of people, but the research gap is that studies on India are far and few between, and most of the studies are based on mobile text messaging. Literature review on cost effectiveness, they show mixed results. So some papers have found mHealth to be cost effective, while some have not found that to be cost effective. And literature considering the service quality, there are no empirical papers, there are only conceptual papers. And the author found two conceptual papers by the same authors. And this paper attempted to conceptualize dimensions related to service quality. By and large, the author states that there is no direct literature which compares the cost of online and offline care. There is no literature examining whether online care has reduced trips to family physician, and there is no literature which empirically examines service quality of online care. Research methods. The health sector is broadly divided into 4 sectors. In considering the Indian startup ecosystem, startups providing healthcare services to people, startups producing medical devices, startups creating enterprise technologies, and startups providing personal health management tools to people. So out of the 4 sectors, medical devices and enterprise technology business models are primarily B2B, and therefore we focus on B2C. So out of the 2 B2C sectors, we choose startups which provide online healthcare services to people. Why? Because in this business model, startups are directly reaching the people. So therefore, it will be it will enable us to gauge the usefulness of the online healthcare services. Target variables, we are looking at 4 variables. First, accessibility of online care. Second, changes in the health status of the people due to online healthcare services. Third, cost effectiveness, and fourth, service quality. The questionnaire was put on social media websites and WhatsApp groups. The respondents majorly hailed from metro cities, especially from Bangalore. The fieldwork was conducted between September to December 2022. Convenience sampling was adopted, and this paper considered primary care, day-to-day care, and not specialized services, for example, provided by gynecologists, psychiatrists, etc. The sample size is 36 because the author could obtain only 36 responses. Findings, table 1 shows the social demographic profile of respondents. So the median age of our respondents is 33, and considering gender, more than 50% of our respondents are female, and considering the education level, 100% of our respondents have acquired tertiary education. Annual income, more than 50% of the respondents come from the middle income group, and considering the company or the startup whose services they were using, more than 50% of the respondents were using services of Practo. 25% were using the services of pharmacy, and 22% were using the services of M5. Able to compare online and offline care. So we asked the respondents whether they are able to book appointment at the first call. So in the offline setup, almost 86% of the people said yes, they are able to book appointment at the first call. But there are some people who were not able to do that. In the online setup, this is not applicable because you book an appointment the moment you open the website. Waiting time to meet the family physician, considering median, people wait for 1 day to meet their family physician, and considering the online setup and considering median, people wait for 1 hour to meet their family physician. Charges per consultation, both the types of care are equally expensive. Okay. Kilometers traveled to meet the family physician, considering median, people travel 3 kilometers to meet their family physician. They spend 100 rupees per trip, and they spend 2 hours per trip. This is not applicable to online care because there is no traveling involved. Then we also compared number of trips made to the family physician before and after the use of app. So considering median, initially people were making 2 visits to family physician in the period of 6 months. And in the online setup, people were making 1 visit to the family physician in the period of 6 months. So the number of visits to family physician has reduced when people are using online healthcare services, but online healthcare services have not substituted the offline care, and maybe one would say that they are complementing the offline healthcare services. Table 3 shows reasons for reduction in visits to family physician, and people have reduced visits to family physician. Point number 1, because they are able to get the care in a speedy manner, and also the care is available at their convenience. Then psychological scales were made, so we considered 4 attributes: accessibility, reliability, competence, and overall satisfaction. Accessibility is defined as the extent to which the service is available, where and when it is needed. Okay, so basically whether the service is available during emergencies, during off-office hours, during weekends, etc. And then reliability is defined as consistency of performance, whether the services, whether people perceive the service to be consistent, regular, and dependable. And then the KR20, we also assessed the internal consistency of the scales. KR20 value, KR20 is a Kudari Jerson measures. So they measure the internal consistency of the scale. So a value near to 1 indicates that the items are measuring the construct in question appropriately. So all these scales have a high KR20 value because they are near to 1. This scale is competence. Competence is defined as whether people perceive doctors to have required skills and knowledge. And also we also assessed overall satisfaction, which is the degree to which patients are satisfied with the startup services. Again, these 2 scales have high KR20 value. Now, what the author did was, the author gathered the total scores of these scales and plotted the frequency distribution. So these are the frequency distribution of the scales. And as you may see that in the context of accessibility, reliability, competence, and satisfaction, the scores are clustered at the higher end. So this shows that a higher percentage of respondents believe online healthcare services to be accessible, reliable, competent, and they are satisfied with the online healthcare service. But when the author asked whether after following the advice of the doctors online, whether patients are able to observe a change in their health status, so a greater percentage of respondents said that somewhat we are able to see changes in the health status. So this is a gap here, and this shows that online healthcare services can improve their competency. And then we asked whether the use of online healthcare services increased during COVID lockdown, and many said yes. Then we also looked at whether old and young people perceive online healthcare services to be equally accessible, reliable, and competent. And then we found that both the age categories, lesser than 35 and more than 35, both the age categories perceive online healthcare to be equally accessible. And we also looked at gender. So our respondents were majorly from two genders, male and female. And these, both the genders found services to be equally accessible. And we also looked at whether the two age groups and the two genders found services to be, they were equally satisfied with the service, and both the genders and both the age groups we didn't find any statistical difference considering Moore's test of median, and we found both the genders and both the age groups they were equally satisfied with the service. Limitations of the paper. The paper has a small sample size, 36, and the scales lack reverse score statements. So these scales all have positive statements, they do not have negative statements. So inclusion of reverse score statements will improve the robustness of the scales. Moving to discussion, the author has found favorable effects of online healthcare on accessibility, cost, and patient satisfaction. This paper resonates with other academic papers which have found positive effects of telemedicine. Nonetheless, some papers have found no conclusive evidence. Also, the author wants to say that these services are available to people who have access to internet. So people with low socioeconomic status and people who do not have access to internet are excluded from availing these services. Also, so there have been, since there are no regulations regulating this sector, there have been calls to establish minimum standards for the technology. And to begin with, what we can do is we can ask startups to take certifications wherein principles and standards can be laid out. Implications of the study. So online consultations have reduced waiting time, travel time, and cost, which makes healthcare more accessible for people who otherwise postpone or avoid visits. Since people can access doctors quickly and reliably, they are more likely to seek care early rather than delayed. While online healthcare lowers barriers, access still depends on internet connectivity. This study shows that patients perceive online platforms as reliable, competent, and satisfactory, which is validating the business model of the health tech startups. Also, since patients trust the competence of the doctors online, regulators must ensure licensing, accountability, and malpractice safeguards. With this, I finish my presentation.
That you are dealing with a domain where you cannot collect so many, samples. So sample 36, 34 is alright. So it's not actually less sample. And generally, we assume that about 30 should be there. Most of the, because actually sample is moderate and low, that way I'm telling. If you can include in this one some quotations when you have interviewed them, or you can reapproach them, bring some nuanced questions, particularly, one biases which is emerging, which you have already highlighted, that most of them have tertiary education. Now, what I want actually is if you can make a matrix, a table, in which maybe that the people are tertiary educated, but which medium they are educated, whether they connect to the same language or the language becomes a barrier. So if you have the doctor is speaking one language, patient is speaking one language, that may be one issue. Second thing, even in those categories, income may be another category on which actually the people may have some differences. Gender may be another, diseases may be another. Telling online, for example, for gynecological problems, if you online telling may not be very comfortable. So what type of actually the diseases which actually the people are more comfortable? So the two things which I suggest, and the paper will be excellent. I think that what I see the potential. If you add to that some ethnographic observations, which the people tell you, and the thick narratives, maybe that 50 words and 60 words, if you can quote them, that this is what actually they say, and the peculiar cases, which are actually aligning with the whole theme. And second, make a table where actually you can have the access of the category, income, gender, disease, and other, and then how it actually performs in the telemedicine kind of situation, not in the public, so that it becomes complete. Thank you.
Thanks for your presentation. I have a few queries and then probably then a few comments if you feel like including those comments while revising your paper. So, I mean, this whole theory of disruptive innovation is essentially, in most of the startup context, is seen with the network effect that, these kind of technologies that they create. So, are you planning to look into that? Have you looked into that? That how the disruptive innovation actually goes into network effects and then create an ecosystem in which these kind of solutions sort of sustain? I was also curious, so healthcare is a very, very broad domain, right? So that could be like, it includes like the normal flu to the chronic diseases, and there are different categorizations within that. There's physical health and there's mental health, and there are other things that happen. So, have you put like all sort of healthcare into one category while preparing your question? Because your question looks very, very extensive. You tried to include several angles into it. But do you think that the respondents would have a different answer when you deal with a specific sort of aspect of healthcare? I agree with Shadab that, this seems like a good sample, but given the kind of questions that you are trying to answer, do you think it would also be good to sort of incorporate or support this with, if possible, if you get a chance, interview some of these startups or some sort of focus group discussion that you could have. So that would be a good way to see it. And I think one of the questions that's emerging that you have to see how does it find relevance in your paper, but most of the literature that's coming up on the startup, they also are looking at the roles of VCs, like why are they putting up money and, what sort of objective do they want to achieve? So if like all of these are very loose ends, how do you kind of put it together? But the one thing that I think that can really help to, improve is to that the surveys that you have put up online through WhatsApp and the other channels, if that can be supported with some sort of interviews with the experts or some sort of focus group discussions with the different stakeholders in this space. Thank you.
So I think so a lot of them are suggestions. So I want to club what ma'am and sir told regarding whether the online healthcare services can be used in terms of chronic diseases and others and specialized care. So I had mentioned in my questionnaire, so while the respondents were filling the questionnaire, so I had mentioned that this question is for primary care, day-to-day care, and not for specialized services. Okay, and I want to agree with you that, for example, wound injury cannot be treated online, okay? You might be able to do diagnostic tests online, but then if you want to show it to the doctor, you have to physically go to the doctor and the doctor will examine it, right? So, online healthcare at present, it's serving only the primary care and not specialized care, okay? Then, theory of disruptive innovation, ma'am, so when I chose this theory for my analysis, so I did not look into the network effect. So I looked at the basic premise of the theory, which is the theory states that cheap and small innovations are brought by startups, and that's what my focus was on.
Okay, because these models, these technologies and models that are there in healthcare, they're all cheaper, smaller. For example, point of care diagnostics, okay, and enterprise technologies. So these are invented by startups, and that's where the theory comes in. Role of VCs, ma'am, I think that VCs want to generate money. So if they are putting money in 10 platforms, maybe 1 or 2 run, right? Only 1 or 2 generate money. So I think that, and maybe some of the VCs might want to create an impact. Okay, so I think that's why the VCs are involved with the platforms. Okay, thank you.
Thank you so much, Amreen, and thank you, panel, for your comments. We will now move on. I think Khushi is here, right? Yes. So, ma'am, sir and ma'am, for your note, we have the first presenter here, so we'll just go back to first.
Good morning to all dignitaries. I'm Khushi Singh, and today, along with Saurav and Anshuman, I'll present our study on gender digital divides in Telangana and how those divides shape women's engagement with urban e-governance platforms such as GHMC and eSeva. I'll cover the data sources, core findings on access, skills, and financial agency, barriers, and policy recommendations. Is a list of the key discussions we'll be involving in as we go to the course of the presentation. And I begin with our research focus and objective. So our central question is, how do gender patterns of access, skills, and financial agency shape women's engagement with digital urban governance in Telangana? The study aims to map gender gaps in device ownership, internet use, ICT skills, and digital transactions, and link those gaps to practical implications for GHMC and eSeva uptake. Finally, we conclude with policy recommendations. So in order to situate this, we next move to the Telangana's governance context. So Telangana has rapidly adopted e-governance, GHMC, eSeva, TAP. These are framed around managerial KPIs and dashboards, but many platforms have seemed to be usability heavy, English-centric, and reduce smartphone literacy. That in itself creates an institution of user mismatch. Platforms promise faster service, but skewed access and usability can exclude peri-urban and low literacy users. So our evidence for all of these arguments comes from the CMST 2025 database, and now we shall discuss how we've used it. So as part of our data and methodology, we draw primarily on the National Statistical Office's comprehensive modular survey on telecom services. It provides gender disaggregated measures of mobile ownership, internet use, ICT skills, and online banking across Telangana. Our approach is descriptive statistical analysis paired with qualitative interpretation to link numbers to existing social structures. So now that our data and methodology is clear, we move to the results, starting with ownership. So mobile ownership is strongly gendered. In Telangana, 90.4% of men over the age of 15 own any mobile versus 65.2% of women. Urban and rural differences amplify this. Rural women's ownership is only 53.6% compared to the 87.7% of rural men. Phones, you see, are often bought and registered under men's names, and intra-household spending, priorities, and norms shape who actually gets to control these devices. So when we're talking about control over devices, the next argument that we should take up is what are the different kind of device types and how they matter. So next we have the smartphone and device type. Smartphone use is about 73% overall in Telangana, but 77% of men versus 68% of women use smartphones. Women are overrepresented among basic phone users. That device type blocks access to app-based e-governance. Say, if a woman only has a basic phone, she cannot conveniently access eSeva mobile apps or the GHMC forms. So this in a way directly feeds into internet use gaps. Overall internet use as for the last 3 months is 72.2% in Telangana with a clear gender gap. 79.9% of men versus 64.9% of women. In rural areas, the gap widens. 71.1% men versus 50.7% women. Younger cohorts do show smaller gaps, but older and less educated women remain mostly offline. These patterns in itself limit women's exposure to civic tasks online. So access is necessary, but not sufficient. What also matters is capabilities. Hence, we discuss now about ICT skills and digital literacy. We measured basic ICT capacity by activities like sending a message with attachment. So 69.3% of men report that skill versus 53.3% of women. Many women are digitally too naive, using phones mainly for calls or simply messages, and report weak life handling, email use, and confidence with forms. This dependence creates a need for intermediaries to complete e-governance tasks, leaving women at the help of the male counterparts in their households. Now, that lack of skills maps into constrained financial agency online as well, for which we brought in the discussion of digital transactions and financial agency. So online banking capacity is another axis of exclusion. 74.5% of men over the age of 15 can bank online versus 53.1% of women. Rural women are particularly disadvantaged. Without online payment skills or control over accounts, women can't independently pay the municipal fees or use e-payment features of GHMC and e-Seva, increasing the friction and dependence. So these numbers come with clear socio-structural barriers. So now I think it's time that we start discussing those barriers. So the barriers are structural: intra-household power, men controlling spending, and safeguards. Social norms, policing women's phone use, lower and unstable incomes, care burden that reduce time for learning, weaker digital education, patchy rural infrastructure, and safety concerns online. So together, these keep women as secondary or dependent users of e-governance. So what should policy and design do? So for that, we have 3 practical directions. We recommend a gender-responsive digital strategy with 4 major pillars: improve device and data access, subsidize smartphones, targeted data plans, community digital hubs only reserved for women. Next is tailored digital literacy, women-focused training on GHMC and e-Seva workflows, online safety and payments scheduled at convenient times. Next could be women-centric service design, mobile first, then local languages and voice navigation. There could be women-staffed help desks and acne seva counters, something that makes women feel safe to come and avail of these opportunities and applications. Lastly, institutional reform. There's a need to collect gender disaggregated user data, include women's group and advisory bodies, and support women's digital entrepreneurship. These are practical and directly address the access skill agency chain. So, to in a way close, there's a short conclusion and a way forward. In sum, Telangana's digital transition risks widening existing inequalities unless access, literacy, and institution design explicitly account for gender. Our evidence shows consistent female disadvantage across ownership, use, skills, and financial transactions. Closing these gaps require combining connectivity, tailored training, women inclusion design, and institutional reforms so that e-governance becomes genuinely inclusive. Thank you.
Now we'll move on to the questions. Ma'am, sir.
I'm sorry, I didn't note your name. It's not written here.
Kashmir.
Okay. All right. First of all, um, the kind of problems that women face, and then how do you solve it? Um, it would be nice that in a research paper, these three sections sort of speak to each other, like the problems that we are sort of finding. So let's say one of your finding, I'm just giving you an example, that is to give voice and digital entrepreneurship facilities for women and all, and you say that this will solve the problem, where while you're identifying the problem, there's no connection that if women have lesser phone and lesser smartphones and lesser, let's say, digital skills capabilities, and also it's because there are lesser women who are leading, let's say, women's digital, entrepreneurship or something like that. So that just doesn't sort of connect, like the problem statements that you're identifying and then the solutions that you're sort of offering. There is, some sort of gap. When we pick up data from some other source, our addition as researchers could be to, do some sort of secondary analysis to either, verify it or falsify it. There could be different ways that it can go into. Either you verify, yes, this is how it is, or you say that, no, this doesn't work that way. Because see, this is like the general, this will speak to many other sectors, not just the digital governance sort of sector. When you say, let's say, Me Seva app that you're talking about, so have you done any specific study on Telangana women who use Me Seva app and then they say that, oh, okay, this interface is not working for me? Because you are sort of suggesting that work on the interface, like human-computer interaction. So we can do some sort of study in which we find that whatever, and it could go to like whatever you are saying, but then right now it seems like that we pick up some secondary data and then we analyze that these are the challenges which are like the global challenges across the sectors or something like that, and we then come to some sort of policy recommendations. So my suggestion is that you bring some sort of coherence between these three aspects of your paper, because you picked up a good theme. Telangana is a good, case study to, kind of look into in terms of tech advancement that have. I also have a suggestion, if you go to the latest literature that's being done globally on this study. So when you, for the women and the other, vulnerable groups in the society, the literature has been highlighting that there's not just the infrastructure and knowledge gaps. So there are different level of gaps that emerge when you study digital divide and digital, sort of exclusion studies when you see. The contemporary literature is also dealing with the confidence deficit that, even if you have good smartphone and you have access to internet, high-speed accesses and all, your socioeconomic background will also translate into how much confidence do you have in order to sort of engage with it and all. So maybe you can look into some of these studies and see if that fits into what research problem that you are sort of trying to make. Okay, hope it's making sense.
The patriarchy come from that and then say that actually it's reflected in the data, the literature, and then what the new data also shows for the Telangana, though it is a developed state. So problematization actually take in that kind of context. Second thing, what you do when you have taken this sample from the data, it automatically what it does actually you can extract the data, but take the sample. How many samples are there? Because sometimes actually it is 100 or less than 100 or 150 now, the confidence may be low in the data. So they take that one, make some cross-tabulation possible. For example, when you say that there are barriers, so either in the data, look at whether some barriers are given, that these are the reasons why I am not using. So cross-tabulate them to show that, or actually bring the barriers from the literature, so that in order to make it complete. Otherwise, it remains that what part you take. So, major thing which I found that the barriers which actually gave in the this one, try to put into the findings from others. What others have found that these are the barriers, because we are not knowing whether the barriers are emerging from your suggestion or actually coming from the literature. Already scientific literature they are coming. I think this will strengthen the paper very well. So take it forward.
Today, I present my research that examines how digital governance platforms such as SACS, UDIS, and APA affect administrative workload teaching priorities, and equitable access in Karnataka schools. Although designed for transparency and efficiency, these systems can deepen existing disparities. Using an urban government school and a rural aided school in Bengaluru South as case studies, the central question becomes how can these platforms promote true inclusion, not just procedural efficiency? Digital governance uses technology to build transparency, accountability, and inclusivity in government systems. In education, it supports monitoring and management through platforms, data analytics, and automated decision making as defined by major organizations like UNDP, World Bank, and UNESCO. Existing literature highlights both success and persistent barriers. Infrastructure availability, digital literacy, and connectivity are major roadblocks, especially in rural areas. While initiatives have improved processes in higher education, the benefits are uneven, and risks of reinforcing inequalities remain. Studies find that limited access to internet and devices hampers rural education. Efforts to address divide must go beyond just technology. Localized content, teacher training, and infrastructure investments are essential to ensure equity. Evidence supports participatory design where stakeholders like teachers and students inform technology development. In India, resource constraints and power asymmetries limit truly inclusive solutions. To make digital governance equitable, localized and user-driven design is vital. Despite advances, less than 60% of Indian schools have computers or internet. Karnataka schools lag further behind national averages. Well-resourced schools benefit greatly, while under-resourced schools struggle with delays, fragmented data, and increased errors, often shifting teacher focus to administrative tasks. Digital platforms have expanded reach but often neglect marginalized learners. Exclusion based on caste, gender, disability, and socioeconomic status persists, especially in rural communities. Lack of localized content and participatory planning further deepens inequalities. This research asks how do technological needs, platform design, and implementation practices affect administrative workload, pedagogical priorities, and equitable access for diverse school participants. This was further broken down into specific sub-questions to develop detailed understanding. A quantitative case study approach was used to explore the lived experiences of school actors. Methods included in-depth observations, informal interviews, document reviews, and thematic analysis, focusing on both urban and rural schools. The urban school had multiple computers, dedicated staff for administrative work, and augmented resources. In contrast, the rural aided school managed with a single computer, mobile data, and very limited support, often relying on community builders to fill gaps. The state mandates compliance but fails to provide differentiated support. The resulting infrastructure gaps create substantial barriers for aided and rural schools, demanding the rethinking of resource allocation. Digital governance faces poor platform integration between the state and central governments. Teachers and staff manually integrate data across multiple systems, often keeping parallel paper records due to distrust in digital systems. Design flaws like rigid name matching for RRIDs exclude marginalized families. Urban schools cope by sharing digital workload via Google Drives and WhatsApp, sometimes making ethical compromises to meet reporting deadlines. For example, staff marked all students present on SAS linked midday meals. Similarly, they randomly marked banana or egg distribution to students on a daily basis. This was due to high student strength. On the other hand, The head teacher of rural school lacked formal training and sufficient support, causing him to juggle teaching and administrative duties. Design flaws and ethical tensions are hugely absent from scholarship focused on access or usage. Lack of staff and platform dependency routinely displaces instructional time as teachers and staff prioritize compliance over classroom teaching. For instance, in the rural area school, when the part-time assistant assigned by the trust office was unavailable, the head teacher often uses class time to upload SATS data. In urban KPS, when the government-appointed clerk is absent or occupied, the computer teacher sometimes postpones computer classes to complete the attendance and the daily uploads. These shifts result in students being left idle or only engaged in trivial activities rather than learning. Further, server delays during peak hours, slow loading of student lists, and delayed OTP generation for login all disrupt schedules. Combined with sluggish data uploads, such technical disruptions and administrative overload negatively impact the core educational mission, demonstrating how governance pressures can override pedagogical priorities. In the urban school, information about scholarships is typically shared with students in assemblies, but students and parents are largely left to manage the actual online process by themselves. Many turn to local cyber cafes for help, yet some families lack both access and necessary digital skills, resulting in uneven opportunities for support. In contrast, at the rural school, the scholarship application has not been initiated by the time of fieldwork. This was mainly because staff themselves were unfamiliar with the actual process, leading to the exclusion of many SC/ST and minority students from entitlements that should have been available to them. Access to entitlements like scholarships depends not just on digital literacy, but procedural literacy also, which is the ability to navigate the application processes. Where staff lack this capability, students, particularly from those marginalized groups, are excluded, highlighting the gap overlooked in policy discussions about digital inclusion. Policies that assume digital processes as naturally user-friendly ignore barriers like low literacy and poor connectivity. For example, using the word "saulabhya" for online application of scholarship while rejecting any offline submissions indicate to this. Furthermore, limited multilingual interfaces observed in UDIs and APAR platforms exclude non-Hindi and non-English users, especially those from rural Karnataka, creating further obstacles to equitable access. Emerging from the public-private partnership framework, the three platforms, UDIs, APAR, and SATS, differ in their developer origins and support mechanisms. However, staff in schools often rely on informal channels for help, thus strengthening the disconnect between platform designers and end users and diminishing accountability and trust. Absence of structured formal training for the administrative staff in schools means they rely on informal tutorials shared via WhatsApp. This bypasses meaningful feedback between users and policymakers, further embedding a top-down governance model that excludes school-level voices. The following discussion emerges based on the findings of this research. The greatest disparities exist between school types. Here, the urban school navigates platforms with more ease due to resources, while the aided rural school is consistently disadvantaged. Therefore, before imposing compliance mandates, government support, both material and human, is critical. Platform fragmentation and lack of integration between different platforms breeds redundancy and ethical compromises. Teachers are often reduced to data entry operators, and compliance-driven systems can distort everyday school practices under pressure. Design flaws like rigid ID verification reinforce exclusion, especially for migrant and poor families. The broader API model risks becoming a control mechanism if it neglects participatory design and contextual adaptation. Device access alone is not enough. School staff may lack procedural knowledge needed for digital applications, particularly in rural areas. The presumption of universal digital readiness in policy deepens exclusion for marginalized communities. Therefore, to realize the potential benefits of digital governance, equity in infrastructure and resources, integration of systems, structured digital literacy training, flexible identity protocols, and participatory governance are essential. The study recommends differentiated government support for schools, integrated platform redesign, structured procedural support, and inclusive participatory policy processes. All are needed to address trade-offs, accountability, and language barriers effectively. The aspirational vision is for digital governance to support, not control, school communities, co-designed, contextually adaptive, linguistically inclusive, and focused on pedagogic integrity and equitable participation for all. It's important to note here that the findings are based on 2 case studies and may not represent all school texts. Future research should expand to diverse contexts and explore long-term impacts, participatory design implementation, and intersectional exclusions in digital governance. In summary, digital governance platforms promise transparency, efficiency, and inclusion. Yet, they must evolve beyond compliance-driven control towards meaningful engagement and reform that prioritize educational equity and pedagogical integrity, especially for marginalized communities. Here are the references used for the study.
So now we can move on to the questions. Vineet is here.
It's because at this moment, the paper becomes an opinion piece. Because look at when we deal with the science, then it is the method which that makes the science any scientific paper. So you have to either quote that, the qualitative study, if you do ethnography type, when they are working, what they are going through. So you need to really quote, bring lots of quotes in the ethnographic format. Then it becomes complete. Otherwise, if you have now this like summing up the literature, general knowledge in this area through the literature review. So you have, and it becomes an opinion piece. So what I suggest, just bring some good clarity and good ethnographic things because you are connected to those schools. Go through and add to that. If you look at any qualitative study published, in some like Asian ethnography or Asian ethnicity, mostly it publishes on the ethnographic studies. So look at some of the literature which are actually there, benchmarking, scientific paper. Look at them and add to that. When somebody you are explaining one or another variable, we are not understanding whether the things are coming from the data or coming from you. You understand? So as a subject, we have to withdraw ourselves behind, let the data speak in the scientific literature. And this data you need to speak. Although you have everything, but you are speaking, not the data is speaking. And that is actually the major flaw at this moment of this paper. Otherwise, you have excellently covered everything. So let the data speak. That's what I say.
Part of your some sort of thesis, or this is like independent paper?
It's part of my thesis. Yeah.
What,
PhD.
like the master's PhD thesis?
PhD.
Where?
At School of Education in Mahindra University.
Sure. Okay, so and is it like you just started it off, or are you planning to expand, or how does it look like?
Yeah, this is based on just 15 to 20 days of field work.
Yeah.
The field work will continue again in December and will proceed.
Yeah. So again, I think one very, very visible, as Professor Shadamas also has highlighted, a research based on visiting 2 schools, will not give you any substantial findings to give policy recommendations. Either as he suggested that you do a very, large ethnographic study. I mean, because see, when you say that this is a study on education, let's say in Karnataka, which is also your title, I mean, any reader or a reviewer will expect that you give us Karnataka specific insights. This is, the insights and everything that you're giving, that could be just too generic, right? Everywhere you can sort of make it applicable. So what is so unique about Karnataka that you will only get to know when you just go into, deep into ethnographic studies, and where teachers and the other stakeholders in this process, they tell you that, this. So I read a study in Maharashtra, for example, recently. I was a reviewer in a study which was done on some district in Maharashtra, a similar study, where they highlighted that the way portal is designed for this, not just apart, but some local, sort of scholarship that people from marginalized communities children from marginalized community can, sort of get. So the columns are made only in terms of first name and the second name, and for the many communities, what do you write in your first name section and the second name section could be different from what you've written in Aadhaar. Okay, so the data doesn't match and the application gets cancelled. So these kind of thing, if you could sort of highlight when you're talking about digital governance in the education system. So first of all, you really have to expand your database. If we visit only one school in the urban area and the one in rural area, we can't really reach to the policy recommendation sort of stage. Expand your database, as you've already highlighted your limitations, you have to go to different other types of school also. So go there and then try to find the insights which are very, very local in nature, which have gone missing from the policy landscape. Like they have not been noticed. So that would be really a good value addition to the existing literature. So yeah, these are the suggestions.
Okay, thank you. So some of the responses or the comments that I would like to respond are for the whether this is an ethnography or a qualitative study, right? So of course, ethnography can be part of the overall qualitative way of working. But the difference is that here I'm looking at cases. So these are two cases that I've taken. Yes, there will be two more cases in different districts, which will include a private school as well in the future studies. So yeah, I agree that from smaller samples, policy recommendations cannot be generated. I would maybe frame it differently than recommendations. Something to be added. What comes from this is that the methods used are also slightly what is confusing, I suppose, because it includes observation and informal interactions along with review of the documents and the websites. So as we had seen in the pre-presentation, there were some suggestions. Based on that, I have gone back and looked at the websites as well. That will as a review of the portals. So that adds to the data collection method. And it's not an ethnography for the first step. That's why I haven't quoted anything as such, but I'm not sure whether it is still flawed because it comes from informal interactions which are not audio recorded. They are written as notes, paraphrased in my own writings, and observations of how the work is being done. So when an admin assistant or the head teacher is doing the work, I'm observing their work and what are the challenges they are facing or what ethical compromises that they are making. So those will not have quotations or quotes as such. So I would like to differ that it's not really an opinion piece, rather coming from generated data. Yes, as of now, I've been able to look at the SAT's website, which is specific for Karnataka. Then making it more specific to Karnataka, what I was looking at is, are there language adaptations? And as I've presented, the UDICE has only Hindi and English. APAR only has English, and for Kannada, they have only made 4 PDFs as training purposes, rather than making an option to translate the website itself into Kannada. And more specific to Karnataka, the SAT's website, that entire portal is developed by the Department of Education of Karnataka in association with a private company, and that is their main go-to, that all the data is uploaded from school and teachers, students, everything on that. So that is, I think, one of the major things. But remunerations and insurance, those kind of things. So I think I will look at some more nuances, some more local issues that concern teachers and students within the school education of Karnataka in the next stage.
Keeping the method,
Right.
you have everything.
Right.
This method you will.
Yes.
So now we will be moving on to the fourth presenter. Do we have Zishan in the room? Yes. So now we will be looking at the paper titled Governing the Digital Commons and Ostromian Analysis of Cultural Recognition in India's Digital Public Infrastructure.
I will be presenting the research paper governing digital commons and a constant analysis of cultural recognition in India's digital public infrastructure. At its heart, this paper tackles a core paradox in India's public infrastructure, or DPI, is a massive celebrated success in efficiency and scale. But we argue that it is a top-down standardized design poses a systematic threat to India's deep cultural and linguistic diversity. The problem we diagnose is an algorithmic humanization, the flattening of a local culture into single machine-readable norms. The solution we possess is a algorithmic pluralism, a new polycentric governance model to protect that diversity. First, let it be clear, the success narrative is clear and real. The DPI is a global significant achievement. We have all heard of a jam trinity, linking bank accounts, biometric ID, and mobile phones, which has been transformed service delivery for over 1 billion people. We have used UPI, which is now a global leader in a real-time payment, and direct beneficiary or benefit transfer have been internationally prized for the building state capacity and reducing corruption in welfare. This model is now a pillar of foreign policy being exported globally. But it's the core of our paper too. The success masks a profound structural paradox. The system is a built for a legibility. It needs to be seen. Society is in simple, standardized way, but India is not simple. It's a hyper-diverse. The system's top-down, often Western-centric design is epistemically unsuited to this reality. It simply cannot see the thousands of local dialects and cultures. This isn't a neutral act. We argue it's an active force for what we call algorithmic humanization. This is a centralized linguistic monoculturalism, where standardized Hindi or English erases local languages, creating a significant uncounted cost. This lead us to a primary situation: how does this standardized design affect dialectic pluralism, and what polycentric or multi-centered governance mechanism can counter this humanization? We also ask, what specific design feature causes this harm? What have local systems like Kerala already mitigated it? And what practical institutional instrument can be built to fix it? Conceptual framework. To diagnose this problem, we have used James Scott's concept of a legibility state. He argues need to simplify reality to governance, reality to govern it. In doing so, they flatten what he calls metis, a local, practical, informal language and knowledge. In India, metis is a local dialect and community traditions. It non-standardized and non-computable. The DPI, by its very design, is built to ignore this metis. The modern data-driven outcome of a flattening is a algorithmic humanization, where the system default to the dominant group's data profile and reinforces monoculture of a knowledge. Perspective of architecture. So, what the solution? With turn Eleanor Armstrong, the polycentric governance, this institutional antithesis of a single top-down system, a system with a multi-independent center of a decision-making. This isn't about replacing national DPI, but complementing it. It's about creating institutional space for local nodes to protect their own culture. We also apply a critical lens to this. Must be about epistemic justice, actively empowering subaltern voices, not just local elites. This synthesis gives us two new core concepts. First, the algorithmic pluralism. This concept treats pluralism as a design variable, not a. The goal shifts from a frictionless efficiency to resilient, inclusive governance. And the second, algorithmic friction as a mechanism. This is a deliberate beneficial insurgence of a human checkpoints. It's how we intentionally reintroduce that human local metis back into the automated system to check its power and override its failures. Methodology and analytic strategy. Our method was a theoretical study using 4-step mixed secondary data synthesis. We didn't collect new primary data. Instead, we synthesized one national survey data and digital divide. Second, technical reports on algorithmic bias in an India-specific model. And third is a comparative case studies like the Kerala Akshay network. And the fourth is the DPI's own architectural documents. Synthesis of harm. Now, the analysis of harm the DPI's design creates a structural exclusion. Think a manual letter who burn fingerprints make them eligible to Aadhaar card scanner, locking them out of essential food chains. That is a epistemic failure. This bias is now being inherited and amplified by new AI. We call this DPI LLM breach. The biased, non-representative data foundation of a DPI is being used to train next generation AI models. This leads directly to what we call algorithmic deafness, the literate documented failure of a speech recognition system to understand underrepresented dialects. But we found counter-narrative. The polycentric solution isn't just the theoretical. Look at Kerala's Akshay network. These local human-mediated centers are real-world example of algorithmic frictions in action. Here is the case. In a rigid top-down system, if Aadhaar scan fails, a person denied food. The full stop on this food collection. But in a Kerala polycentric model, the local Akshay operator who possesses metis, who knows that person and speaks the dialect, is empowered to intervene. They can use local register to override the automated failure. This human node inject cultural recognition back into the rigid system. Findings. The analysis leads to our three core findings presented as propositions. Proposition 1. The humanization thesis. Centralize the DPI design drives humanization. The harm is feature, not a bug. Proposition 2. The epistemic failure thesis. AI bias is a just symptom of a deeper epistemic failure. A fundamental mismatch between standardized rule and pluralistic society. Proposition 3. A polycentric solution thesis. The only variable solution in polycentric complement using algorithmic friction to re-inject human metis and mitigate these harms. Based on these findings, we propose Plural Aware Visible Governance Framework or PADG. This is our normative policy architecture to operationalize algorithmic pluralism. It has 5 integrated components: linguistic inclusion, community-driven data partnership, mandating algorithmic friction, and integrated socio-technical audit protocol, which I will detail in the next slide, and new DPI governance resilience index, which measures pluralism, not just efficiency. The fourth component is a key. We propose an integrated socio-technical audit protocol. This moves beyond the simple technical checks. It requires three levels: a technical audit for statistical bias against, for example, specific tasks or dialect, an institutional audit to check on governance and diversity of our development teams themselves, and finally the social audit to verify the lived experience of harm with the affected communities. We must note that this is a theoretical paper and propositions are an intervention and require empirical validation. Our future research agenda is therefore clear. First, the empirical being a new pluralism index we have proposed. The second, field validated audio protocol in real world settings. And third, the sponsor of a technical social linguistic research needed to build truly dialectic inclusive AI. In conclusion, India's DPI story is a success, but comes with a profound epistemic cost. Algorithmic humanization is an active eraser of India's cultural and dialectic pluralism. Our paper contributes to provide coherent conceptual solution, algorithmic pluralism, operationalized through algorithmic friction and the PADG framework. The polycentric approach doesn't ask to sacrifice efficiency, but to complement it and a resilient, recognize and justice. Thank you. I welcome your questions.
India's DPI is not AI based. There are some layers that have been added, let's say your facial recognitions and all of that will come into ML and AI and all. But India's DPI essentially is not largely any verification, anything is not AI based. And the algorithmic, verifications and everything that you have been arguing. So these are two different set of challenges, like wherever AI-based solutions are being incorporated, there you can say it. But when you say that whole of India's DPI and then so I'm a little confused, like why are you sort of connecting? So all of these theoretical frameworks that you have sort of picked up is, they have academic grounding, but I'm just trying to, kind of connect that why would you put these things together in the paper? Your paper starts with governing the digital commons, the title and everything, but the analysis of what digital commons are, because that's also a very specific field of study, digital commons, and how these sort of commons are getting affected. So I would say these are too many interesting things put together, but you really have to find a way which kind of speak to sort of each other, like the Kerala sort of story that you talk about. So there are theoretical understanding, or the policy understandings I would say that already exists, is the human in the loop and institutional oversights, like two strong policy frameworks that sort of already exist. So I would suggest that if that is your way to kind of establish this problem statement in the abstract or in the title itself, you highlight that, because when you say this India's digital public infrastructure and then try to kind of fit it into the digital commons theory, then you might have to take a different sort of trajectory to the paper. So probably restructuring your title and the studies, and you really have to find the answer, because any reviewer is going to question you that what part of DPI and AI that you are trying to sort of connect, unless it comes to facial recognitions, or let's say if you study Telangana Samagra Vedika or something, some specific schemes that you study into. Otherwise, largely you sort of cannot claim that.
Thank you for actually taking the theoretical route. Basically, it meets several ways to the non-linear policy, and particularly Holland and other who actually contribute the literature. Because they describe that how the exclusion may happen through the algorithm and how actually we have to be adaptive in the process, and that has to be non-linear, away from the old bureaucratic process of policy making. But what I feel here, some of the things which actually you are writing, Why I tell you this? This is in order to deepen your paper's quality. I say that when you say something, just quote that where it is. Because if I say that this is where it is wrong, where it is wrong, there is lots of exclusion from National Rural Livelihood Mission, and the people are not able. Whether I have seen that, or actually I am quoting from the literature, I will prefer that you go see that, and then that actually becomes very important. Or if you are taking 3-4 issues, at least 3 you are able to substantiate from your empirical, rather than actually on the only literature. So that what I feel that substantiating and basing yourself in the meta-analysis or the other study. So that will be one way. But what I feel that the way you formulated, if you take some really good samples, go there, bring it, integrate it, then it becomes good. Otherwise, there are many papers are circulating. One paper I am sitting with, written by Sharik, and wonderfully written. So what I say, a similar line. But what I suggest that take some sample, deepen it, understand it. Maybe you will come with a different conclusion altogether. Okay, and good decision, good attempt. Thank you.
Now through a community networking system, we see it as a next in the future upcoming model for the theoretical studies which we are aiming for even. We are centralizing everything. Like yesterday we had a workshop on this one even. Why human in loop we needed here is also we have to see forward that Akshaya network is not working as a human loop here. We don't see, if I check my own Maharashtrian e-Seva, it's based on a Poneri Marathi. Poneri Marathi is far different from a Khandeshi Marathi, which is another part of Maharashtra. If we try to engage in that same AI-based model for the engagement, we have to change our speech recognition first of all. So if I'm checking that you are engaging with my own already based Poneri-based Marathi, it's very different from the Khandeshi, and eventually going to be erosion of a particular dialect. And we are arguing for the erosion of a dialect actually here and cultural misrepresentation. Not like a engaging but excluding particular dialect, and eventually it's going to be eroded. That's our point here. And the evidences, Sir said about the evidences, we try to add some samples here with examples, especially like I said about the Marathi one. I will try to add this one to that.
Trying to see that what happens if you are writing in some other language, you may be facing trouble. Other languages are facing trouble. So, it's well known.
Yeah, it's not about just a language, sir. It's about dialects specifically. Like in Marathi, we have six dialects. Aboli Marathi, Khandeshi Marathi, or Vidarbha Marathi is very different from the Poneri Marathi or where we formulate the policies.
No, but remember, we have 2-3 things which is coming to the different kind of issue now. What actually generic languages now. So whether the digital infrastructure will go and be acceptable or actually be very resilient to the dialects, because India has almost 6,000 dialects we are speaking. Now in Maharashtra, Marathi is a standard language. There is a difference between when the dialects used to be escaped, they become the languages. That's what actually is. So for example, we are speaking Awadhi, or actually Bhojpuri, or we are Maghai, or somewhere else, Badi. They are not actually the languages. Remember it. So whether the AI system has to be enough trained to those dialects, and obviously it will be thin training on that. So one can expect the problem in that. So what happened now, that when you are entering into the origin, we expect the problem. It cannot be trained in Chhattisgarh so easily, because we need to really go and train it. But it needs to be trained in Hindi. So where actually the medium of languages. So what happened now? You have opened up, I mean, a kind of strata where actually you're going down deep. That is actually welcome. But at this moment, we are actually intermediate level. So we are actually we can go to the somewhere in Hindi or somewhere we can go in Marathi, but we cannot go Khandesi or actually we cannot go to the Konkani. That is actually trouble for us. So because this has to be trained model, that is a trouble. So that part I don't know. Because here in Hyderabad, the way they speak Hindi is actually Urdu. I will speak different in Mumbai. So that actually is there. महमूद की देखिए फिल्म में कैसे उर्दू बोलते हैं यहाँ पे कैसे उर्दू बोलते हैं हैदराबाद में तो वो डायलेक्ट है क्या करते हैं प्रीपोजिशन और नाउन प्रोनाउन को उल्टा सीधा कर देते हैं then there is a trouble that AI cannot understand preposition noun pronoun ulta सीधा so that is the trouble. So what I suggest is you have taken actually deep thing but when you compare it at the level of state of the art. State of the art is at this moment the language. Dialect is actually maybe that will be robust later on. I mean that's what I wanted to add and give the.
Shall I consider this for as a like a community?
Future.
Add this into the like in a research paper you were saying that dialect will be added into the.
No. Actually, I thought that you said that some Marathi dialects are not recognized.
But also sir like. In Khandeshi Marathi, we have different type of literature too. Like for particular dialects, we have literature like Maithili if we are speaking, or if we are speaking about the different type of
I agree.
Karnataka.
But it may not be accepted.
Actually, literature, we have literature for this.
Trouble is that is not going to the policy.
Yes.
The trouble is that we are actually you are going deep, and then. Till now, the standard of the DPI is up to this, and you are going further down. So that is the trouble. Maybe in future it will become.
So see, can I add to this? If you're in your explanation, you're saying that this, if I understood correctly, this could be a future problem, as in when things go into AI now.
So currently, it's not existing for the everywhere, but yeah, it's existing.
Yeah, but that is not the tone of your paper, or that is not the tone of your abstract. That this might, which would be good research if you say that
It's not about the future work. It's right now we are going through some area like education, let's say e-learning platforms. It's not trained for the tribals.
Right.
So tribals have their own type of even they have their own councils.
No. But why? Whatever examples you are giving, why are they missing from the paper? Like when you go for explanation is like whatever you have been giving, and you use this. Your main title is the digital commons, which you don't establish. Like what is your understanding of digital commons and how do you kind of see it? So you can improve it sort of by including.
बाद में discussion करेंगे because I can see the Lubna's face. She's not very happy that we are taking more time.
Thank you, sir.
Thank you, Jishan.
Yes. Thank you, Zishan. We'll now move on to the next presentation, which is titled The Ethical and Legal Implications of AI-Driven Mechanisms in Urban Governance. Do we have Zafar? Yes, we have Zafar in the room.
Good morning, everyone. My name is Zafar. I'm a co-president in IBC. So, the title of our paper for presentation today is Ethical and Legal Implications of AI-Driven Mechanism in Urban Governance. And the sub-theme of our paper will be focused only on the concept of smart governance and the implications in the case study and the legal manner in Nagpur and Pune, where we are going to discuss and we are going to find out what were the implications of the use of AI in the urban governance in these two cities, and what could be the proposed regulatory framework or model that we can allocate as a nation. So the problem begins with the concept of urbanization. So in the last few decades, we have seen that massively urbanization has flowed in most of the cities across the world, and India is not being an exception. And from starting of the liberalization from 1990s, there has been multiple cities who are in the financial, economic, and education centers, and we have seen a pattern where people have been migrating from the rural areas and the towns and the villages to the cities, which also comes with their own challenges regarding administration and governance. Since India is a developing country, so we are yet to be fully developed in the coming decades. So with that, the challenge also comes that our cities are not developed or equipped to face the rapid urbanization that we have noticed in the past 2 or 3 decades, which is why there has been increased impetus from the central government and the government at large that they are going to rapidly adopt smart technologies which include AI, IoT, and other mechanisms which can help them to administer and govern the city in a better manner, which comes with their own challenges, including transparency, algorithmic bias, displacement of the marginalized communities, and most important is due to lack of transparency, accountability, there is a total erosion of the public trust and democratic accountability. So, a fundamental question in this topic of my research will be how can AI in the urban governance serve the concepts of democracy, equity, and the ideas of cohabitation, cooperation, stewardship, rather than just merely being a tool of surveillance capitalism in the hands of the private entities who are behind the development. So it starts with a theoretical framework where we have tried to discuss multiple authors and their perspectives regarding the state, regarding the concept of citizen and their relationship between the state and the citizen, which primarily includes Hobbes, Locke, Rousseau, and Rawls, where they have challenged the notion of AI in the sense that the whole idea of political legitimacy is challenged by AI, where the mechanisms and the functionalities by which the AI works, in most of the cases, does not have the option of opt-out. So, according to these authors, when there is a tacit consent, it cannot be considered to be a consent when there is no mechanism by which the citizens can say yes or no. Likewise, applying the principles and concepts of Liverpool and Harvey in the years 1960s and 1970s, they also have discussed extensively regarding the idea of governance, regarding the idea of cities, and they have clearly mentioned that citizens in the city should be the co-creators and they should not be merely data points or consumers. So there is an increased impetus on the idea that governance is not something that should come from the government, which is a top-down approach, but rather it should be from the grassroots level, where it is a bottom-up approach. So the background of the study is basically the data that as of now, in the year 2050, 40 to 50% of the populace at large will be staying in the cities, which means almost 500 million people or more will be staying in the cities, which will be causing infrastructure, service, and all the challenges that comes along with it. To counter that, the year 2050 government of India, they have launched an idea called Smart City Vision, in which 100 cities were considered to be the part of the pilot project, whereby the goal was to integrate advanced technologies like AI, IoT, data analytics into urban management. But the challenge was, which was noticed, and which we have faced, is it is often very technocratic, although it is efficiency driven, but most of the times it is excluding the participation of the citizen at large. So over here, I have tried to discuss the different models regarding the governance, particularly in urban areas, whereby they are based upon the different models we are seeing in existence today. Primarily, there is a technocratic model, which is mostly followed by all the cities and most of the cities in India, and there is a participatory model. So, the technocratic model differentiates itself from the idea that it is a very top-down approach, whereby all the decisions and deployments are made by municipal authorities and private tech corporations, where citizens are not treated as decision makers or shareholders or stakeholders or right holders, but they are treated as data providers. And all the technology is used for the better part of it, which does actually help in proper management and governance, but the concept of data that comes along with the AI, which is the fundamental of the smart city, its ownership and the idea of the ownership is very much ambiguous, and the governance as an implication of it is also very opaque. On the contrary, few cities we have seen, they have a participatory model which is more democratic in nature, which includes a bottom-up co-design and co-governance, whereby the citizens are recognized as right holders and co-creators, which are driven by the concepts of transparency, accountability, citizen oversight. And when data is treated as civic commons and not corporate commodity, which means every single citizen will have the equal access or equitable access to the data, and they will have a clear idea that where and how the data is being used and utilized. For examples being Barcelona's Nestle and Amsterdam's algorithm register. So over here, I tried to conduct 2 case studies based upon Nagpur and Pune. So in Nagpur, as for the data, so far 7 lakh citizenship forms were distributed, among which 4 lakh people consulted through multiple workshops and community groups. But there's a concept called Einstein's ladder, which is basically categorized into 3 different parts. The first one is the bottom part, where no communication, no interaction happens. The second is the middle part, where all the communication happens, but it does not lead to any result. And the last part is the highest part, which is dominated and controlled with ethics. So it has been noticed that the concept of participation regarding the e-governance in Nagpur was confined mostly to lower runs, where they were only informed, they were consulted, they were involved, but their opinions did not lack, that did not lead to any influential outcomes and no citizen control partnership in the decision making. And the most important is there was the elite and exclusionary nature of the governance, which was dominated by IT professionals like the Nagpur Smart City Council, where pre-implement solutions without any kind of consultation, like e-bikes, smart buildings, were implemented where the need of the hour was rather material cleaning toilets and clean drains. Now, the issue with the data governance in those in the city of Nagpur was ambiguity, lack of transparency, and integration with the private platforms, where leverage regarding the collection of data was mostly with the private platforms, including IBM, PwC, Ernst & Young. And although the urban governments included CCTV, which largely helped them reduce the crimes, tax collection, police efficiency, but there's no clarity about the data minimization or data utilization. So that is a primary challenge. Regarding Pune, although the model that Pune had worked upon was comparatively better, where the engagement with the citizens happened in 4 phases, including envision, diagnose, co-create, refine, where almost 1.5 million citizens were put, 1.3 million votes were cast, 50% of the people overall participated, and in the co-creation phase, thousands of people participated, and there has been almost 5 lakh social media interactions, but and the participation was done by Smart Pune Samvad, the feedback of the policy, although it happened, but the whole concept was more technical and more technocratic rather actually doing some change in the ground level. So the engagement was more of a participation washing rather than a real engagement. Now, the fundamental challenges was regarding data governance, where the Pune Safe City project had 4,000 AI-enabled cameras, which was allocated to the digital service, and there was continuous surveillance based upon AI. And the command and control center of the police, they aggregated all the data. And the whole issue was the data was treated as a currency rather as a means and mechanisms to help the people, whereby a chief data officer was appointed along with partnership of DCS and Pune joined facilitator for Indian initiative. And there was also open total where 400 statistics were included. But the issue was regarding whether it should be considered to be an innovation or surveillance expansion, where as we know that whenever there is surveillance includes surveillance, including the AI, there is a risk of profiling, discrimination, unfortunately. And the challenge is what we normally face, what we have seen in the use of AI are mostly the nature of the AI, which is black box, there's a risk of profiling, discrimination, and primarily the rights which are violated and initiated Article 21, Article 14, Article 19. And in India, mostly the challenges that we face from the legal side of standpoint or point of view are addressed only by constitutional provisions, that is statutory provisions, because PPTP, although it is progressive, but there are some limitations. Although it mandates for informed consent, data minimization, purpose limitation, but whenever government is involved, either the public-private partnership model or standalone, whenever the government is using the data for national security and public order, that can create accountability gaps. And the most important is we also have a guidelines that is for AI. It is National Strategy for AI, which is non-binding, which does not have any mandate for algorithmic fairness, audits, transparency requirements, reaching oversight. A good example is the Delhi facial recognition system, where the system only had 1% matching accuracy, but it was used initially for child missing cases. Later on, it was used to justify detention of the protest happening in Shahid Bagh farmers' movement. And there was no legal basis for implementing auditor transparency safeguards, which was addressed later by multiple bodies, including Internet Freedom Foundation. And regarding the data, who controls the data? In Nagpur, Pune, mostly it is the privates or the private along with the partnership with the government. In both the cases, the ownership of data is ambiguous. The beneficiaries are mostly the private corporations, where citizens, although are engaged, but they don't have any influence over the implementation and governance. And the problem with data is it is not treated as a shared civic asset, but a private state-controlled resource, where the citizens cannot collectively decide how the data is used. And it reflects the commercial exploitation and surveillance overreach, which we have seen regarding the Aadhaar. So, what lessons we can learn from other cities around the world? Toronto is a good example that how haphazardly the implementation regarding the AI should not happen. Barcelona gives us a good idea that open source platform where the citizen can propose their deliberate can be a good option for e-governance. While Amsterdam, with their algorithmic register, can be a good model for transparency and accountability, where it will help us to ensure fairness, dialogue, and will help us to build the public trust. Now, based upon the findings, I have made some proposals of what exactly should be the parameters regarding the participatory governance in India. One is there should be a model which should be not centralized, but it should be federated. There should be a national level governance structure whereby amendment regarding the NSA should happen, strengthening of DPP should happen, proper recognition of the smart cities mission diagram should happen, and there should be a national level data common whereby where and how data is stored should be known and should be tracked and traced. While on the city level, there should be a mechanism by which we can create algorithm registers model after Amsterdam, citizen data assemblies, participatory frameworks, and open data portals with ethical safeguards where everybody can access and know where and how the data is used. On the project level, these parameters should be made mandatory, that is, algorithmic impact assessment, LTC program, witness mechanism, and community data test, which should be the basis for anything to be implemented. These are some points which I summarized based upon the findings in Amsterdam and Toronto, why they are contradicting each other and why those models, if adopted, should be adopted with care and concern. And lastly, by leading the smart cities should not be only where technology amplifies the human agency, but also where the decisions are transparent and non-stable, and AI can operationalize the right to city to understand how to govern the data infrastructure sharing their lives. But they should be always a human being, and we should be some ethical and other safeguards that should be able to protect them in case if any breach happens.
So, ma'am, we can quickly move on to the questions and comments.
Cases, because some of those things are well known in the literature. What I say, so many things. I myself being urbanization and the smart city researcher. So many things are known. What I suggest that if you take like case of Pune and Nagpur, take with more rigor. Because you're showing several thousand data and other things are collected. If you have access, do that. Otherwise, run some surveys. So what I said, like, bring a rigor in the whole thing. At this moment, you are running from starting to the to coming to the models. So what I want to do that your paper becomes a good paper and you have all the ingredients except the focus. The focus need to, you have all theoretically running around, but you need to go to the deep, how it has happened. Data justice part you write, algorithmic exclusion you write, and surveillance you write, and this give examples. How the individuals and one common citizens, take one common citizens example, and then put on the paper, and include that one on the paper, then it become rigor oriented. That's what I wanted to say.
And you've picked a very good problem statement, and all your case studies also are well in place, like picking up these two cities and everything. But let's say when I was reading your paper, I was expecting more when you were highlighting these legal and policy void in the Indian sort of landscape, and then you write all the sort of emerging celebrated words like data justice and algorithmic registers and data trust and everything, and then there's no analysis over it. Like, how does it actually look like? Let's say if you say data trust in Pune's context, for example, or Nagpur's context, like algorithmic registers or something. So I think if you elaborate more on that, like whenever you're giving the suggestions, if you contextualize, because at the end of the day, your paper claims to bring out, evidences from, let's say, 2 Indian cities. If that's the way to put it. So then, how do, like, whatever suggestions that you're giving in terms of legal and policy void, how would that sort of look like? What do you actually mean by that when you say that? What are algorithmic registers or something like that? So, for a reader, it would be good to kind of make sense of the concepts that you are saying. So, I think one of the strong part that can come out of your paper, this looks like a very big project to me, which can at least have 2 to 3 different papers, sort of going into different directions. So, as of now in this version, what I really like is the legal and policy void that you have. So, you've done the DPDP analysis, and with the new DPDP rules, you might have to sort of revise it a little bit. But if you explain that more and contextualize more, that would be a very good and rich addition to the existing literature. So, thank you.
I also have tried to do a comparative analysis, so more like critical comparative analysis, and how the other nations and other city-states who are implementing the same technology, how they are doing, and which lessons we can take from them. We can build a role model for Indian policymakers and lawmakers.
Sure, but that's not what is written in your abstract. Like, you're trying to look at the policy.
So I should focus on one
Focus.
Yes.
That we will do all the ingredients.
Yes, sir.
Already we are 15 minutes late.
Okay,
We
thank
can
you.
discuss on the lunch also.
Okay, sir. Thank you.
So, the last one.
We have, yes, the last presentation is on co-creation through and within GovTech, lessons from 3 flagship Indian welfare schemes.
Co-production requires that the state or the state board of this creation moves without any bureaucratic filtration and is actually being there. So that becomes very, very interesting. So co-creation is rooted into subsequent citizen evidence, citizen input flows continuously and visibly between field level action and administrative systems, which actually converts participation and presence of citizens in these digital systems into actual power and autonomy and agency or decision making. You have to understand this idea of decision making is also very central to the concept of co-creation. So even though we've had progress in the last 10 years, where citizens have actually been able to interact with the state more effectively, let's say through digital channels, India's welfare stack right now oscillates almost between aspirational co-creation on one hand and administrative streamlining on the other. So true co-creation in many ways still requires a lot of things. It needs systems which are timely, inclusive, and intelligent, which actually turn data, or for that matter, input into realization and feedback into design. And this is something which you have to think about multiple times. How this idea of co-creation could actually look like in the Indian context, and how can we actually think beyond what is already there. Like I mentioned, this idea of data as the first step or first thing that citizens can co-create is something very well understood or well established. But we have to think about how citizens could actually be more inherently involved as co-creators. Now, when we deal with this question, there is a little bit of blue sky thinking which is involved here, because we are trying to visualize something which is not there. So what we do have right now becomes both the base and the constraint for that visualization. So if you were to just think about this at a very basic level, there are new avenues which actually exist for digital co-creation within the current systems and structures. One basic example would be how panchayat meetings could be live streamed properly. But then we also have to think about to what extent that actually would lead to better co-creation. Because at the end of the day, the MIS, which would be archiving or storing these panchayat meetings, would not necessarily be very decentralized. So it would in many ways also not lead to proper co-creation of data or input in that sense. But at the same time, it could be an important step towards that. So that kind of visualization does bring in a lot of questions, does bring in a lot of different facets and caveats, which are very interesting to think about and speculate. But then at the same time, for example, if you look at grievance redressal and how citizens might be registering complaints with reference to certain schemes, then itself it becomes very interesting to understand how that input, right, the data which has been co-created, the input which is actually created by citizens, would actually be more involved in the overall process of governance. So, for example, natural language processing enabled grievance clustering is going to make the input, and this input here, of course, being the grievances, the complaints which are registered, much more usable and effective for the governance systems and platforms. But when we look at this, which brings me to our broader research methodology and design, what becomes very interesting is that there are certain things which stand out within the current systems and structures itself. So, to understand and again visualize what co-creation could look like in the context of Indian governance policy, we decided to look at the three largest schemes based on the budgetary allocations of the central sponsored schemes. So we looked at PM Awas Yojana, the Grameen division, Mahatma Gandhi National Rural Employment Guarantee Act, and Jal Jeevan Mission. And we tried to firstly map out the digital stacks for all of these three schemes and look at certain broader trends which stand out to us in terms of whether the digital stacks or guidelines or structures around these three schemes actually restrict or enable citizen participation, co-production, and co-creation across different phases. And when we try to understand this, there were certain things which stood out to us. And the certain things which stood out to us are broadly about three lines. The first is the timeliness, right, of co-creation. Now, it is intended and assumed that digital platforms will be surfacing evidence the moment it is generated. It should create a certain level of real-time oversight or fund release, or will actually trigger the further processes and parts of the governance cycle. Now, this is the intention, this is what the assumption or intention would be, this is the basic principle. But this does not necessarily happen. For example, in the Awas Yojana, the Ram Sabha rankings and geotab photos are often uploaded late, right, due to bandwidth or operator delays. Similarly, in the National Rural Employment Guarantee Act, what we noticed is that youth that have work plans to auto-state and Narega soft, but GIS layers and master rules often lack weeks behind action. So they might be implemented or created at a certain point, but they're uploaded into the systems and platforms weeks later. So the main thing is that these data flows are needed. So even if we say that certain level of data input is being created by citizens or co-created by citizens and people at large, they're not flowing into the governance cycle or the governance platforms very efficiently or in a very timely manner. So the real-time legitimacy in that sense gets compromised, and also co-creation is not fully realized. The second thing that stands out to us are the participation rights, or the actual level of participation which each scheme allows for each type or each citizen based on where they come from in terms of their socio-economic political background. Now, co-creation inherently requires symmetric and proportional rights, not just to contribute but to contest and trace the outcomes of the broader governance cycles. But what we notice is that these rights are unequally distributed, not just across schemes, but also in terms of the kind of participation which is there. So our PM Awas Yojana, again, as an example, in that sense, relatively has the highest parity or highest amount of participation. Gram Sabhas rank the beneficiaries in the households, right? The citizens themselves, the beneficiaries themselves, upload the geotab photos, which then in turn triggers the payments. However, the Narega scheme actually this splits the rights between workers and citizens, and the Jal Jeevan Mission is even more restrictive in that sense because the village water and sanitation companies have chairpersons or they have field engineers or they have particular individuals or the only ones who can digitize plans and not just citizens at large. So not all actors in the cycle actually hold equal rights in terms of participation, and not all type of participation is equal. Then we come to a very important and interesting aspect of this, which is the digital divide, which is again more about the structural underlying systemic barrier around co-creation. So when we notice that there are bandwidth gaps or lack of last mile capacity, or when we notice that we don't have the technical know-how or we don't have the capability or the human resources required to actually create data to make that data usable, that leaves us with a lot of questions. And again, we have examples for this across all of these different schemes. So interestingly, the groups which are the most welfare dependent are also these able to exercise their digital rights. So these offline hierarchies, right, based on structural inequalities and systemic differences, actually reappear and are reproduced in a connectionized form, digitally or online. Which brings me to our paper's broader understanding or our paper's key takeaway, that this idea of co-creation right now inherently ties into the logic of what Indian governance has been trying to do for many years. That is this idea of democratization or taking governance closer to the citizens. At the same time, the problem is that we haven't tried to really understand or really explore this in a very detailed or deep manner, which is something which we would probably want to improve on. And even within that, like I mentioned, the current reality is the basis but also the constraint on how we could visualize co-creation in the years to come. So we have to think about what would probably happen in the next 50 years and not just the next 5 years. And in that sense, co-creation would be very, very important. And but not just co-creation in the sense of data, but also co-creation in terms of making India's welfare systems or governance systems more intuitive and inclusive, right? And transforming digital governance into a form of democratic collaboration. So this thing needs to be understood very well. The co-creation right now, which just means business getting more involved in the process of planning and developing the policies and the governance cycles and systems, is at a very nascent stage right now. Our understanding of this is very rudimentary. Our paper here mostly tries to act as an exploratory work, tries to do a little bit of blue sky thinking, tries to visualize what co-creation could look like in Indian context, and then understand what is it that we can actually think about. So honestly, there are a lot of questions which we end our paper with, rather than necessarily very concrete answers. But we do believe that this is a very important question which needs to be asked and which needs to be considered. So with that, I would like to end up the paper presentation here. And I really hope that the last takeaway is something that stands and stays with all of you. We are open to any and all questions. Thank you so much.
That would it be better if you first of all situate this whole idea of co-creation in the existing non-digital sort of policy making in the Indian landscape? Is it even a stated objective? Like you claim, like in one of the analysis you claim that Indian government has been trying to democratize this whole process. Can you give some evidence saying that, oh, in this policy, this was written, or let's say some primary source that, Prime Minister said, or something like that, whatever, you have to find some where you say that, okay, co-creation is not happening or happening, limited level happening in the non-digital sort of landscape in the Indian bureaucratic political system, whatever you've been picking up. And then you establish that, okay, then digital gives you this opportunity. Okay, where you some sort of borrow some evidences properly, the digital gives you this opportunity, and given that in the sort of Indian context, this is possible and this adds value, for example. So, like some sort of restructuring the argument and locating it in what we have right now, so that would probably enrich the whole core argument. So that is the solution. Yeah.
I felt it that it's a perspective paper where you try to really build it up from a different perspective and try to integrate. That's what I can say at this moment. If you can integrate more literature in that, because enrich the literature, tell the methodology, how to integrate it, how to co-create. And I think that will be a one wonderful contribution from the perspective building process. Because if you see the EPW, they also write perspective paper. So the perspective paper not necessarily mean that in the future it will be fulfilled, but this is one vision that way you can take it forward. That's all.
Information that is, there is plenty of space where there is an imagination of what the transformation looks like that's being put up, and the state itself is in that transition where there are offline systems that are now being reimagined as online, which is why we picked these schemes. And even within these schemes, the entry points that were mentioned are not exclusively online. So in the example where we're still placing this idea within the Indian context of Gram Sabhas being potential spaces where there's online or just co-creation in general, right? We've realized it's failed that, so definitely there is now a need to do it online. And then in the spaces where it is online, again, it's not exclusively online, it is both offline and online for sure.
So that's true, from creating your abstract in the title, like this makes sense, like what you're saying, but when one goes to the title in the abstract, it looks like that this has something to do with the government tech that you're talking about.
Sure.
So please suggestion, think about it.
So you asked a very good question. Have we been really trying to democratize the process of governance? So one thing which I'll say is this idea of co-creation or co-production for that matter, in terms of its articulation and expression, is very new, right? Not even just within the Indian context, largely speaking it's new. But the premise of that idea, which we also tried to include in the presentation, is this idea that you need to take democracy to the people, right? Decentralizing democracy or involving them more closely. Like they should not just be passive beneficiaries. There should be somebody who gets to have a say, and then you move beyond that, and then you go to co-production and co-creation. So in that sense, we can say that within the Indian ecosystem or Indian governance structure, there has been an emphasis over the years on tech trying to decentralize it. Now, of course, we can to get into the politics behind it would be one angle, but if even we look at a very simple example, the 73rd and 74th Amendment, which the idea was that okay, we'll take decentralization and decision making, decentralize decision making and take it closer to the people. So in that sense, we like that kind of conceptual parallel we can draw. But in terms of the articulation, this is a very new idea. So I like your idea. Like I really appreciate what you're saying. So maybe we could work on that in terms of expressing it properly and establishing it. But yeah, just wanted to mention
it's fine. Like